Hi, my name's Hassnain. I passed my pre-reg in July 2017 and I'm now practicing as an optometrist at Specsavers in Leicester. As an optometrist in high street practice, I carry out eye examinations for people of all ages in the community. I also fit contact lenses and occasionally dispense and fit glasses on patients. Sometimes I would refer to the hospital eye service as well if patients need possible treatment or if I'd like a second opinion on something that I've seen. So I think the reason why I enjoy being a primary eye care practitioner is because I find my work is becoming increasingly varied, especially with the rise of community shared care schemes, be it minor eye conditions or managing patients in a pressure refinement shared care scheme, or even conducting pre and post cataract assessments. So I think you can find it quite stressful. After all, patients are booked into your own clinic and it's up to you to manage your time effectively. And you could also say that it's repetitive, but no two patients are the same, and after all, I don't really think there is such a thing as a routine eye test. But I find it really rewarding, making a difference to the lives of people in my community. So you're probably wondering why I decided to do my pre-reg at Specsavers. I was offered the opportunity to go on a summer placement by Specsavers. It really gave me an insight into what it's like in a high street practice. I was advising patients on their frames, dispensing glasses, but also I was sitting in on sight tests and also observing contact lens appointments. I think it really gave me a broader view of what it's like to be an eye care professional in a primary care setting. And I think that's really what gave me the confidence to feel comfortable in a busy high street practice. So the pre-reg was probably one of the most challenging but exciting years of my academic life. You graduate from university and you've got all this knowledge, but putting it all into practice is a completely different skill altogether. And so I remember in the first few weeks of my pre-reg, it really was a steep learning curve, becoming familiar with the new systems and how the store operates. Luckily for me, I was in a busy Specsavers high street practice, so I've got lots of optoms around me sharing their knowledge and expertise. But what I found most useful were the Specsavers residential courses, because they go through each of the individual competencies. The other thing that I really enjoyed about my pre-reg was the hospital placement, because you begin to see what happens to your referrals at the other end of patient care, but also you can appreciate how pivotal the role of an optometrist is in a multidisciplinary setting. So life after pre-reg is definitely less stressful. There's no more regular assessments to worry about, but I don't think the learning stops after you've qualified. In fact, it's really important to keep your clinical knowledge up to date, be aware of new advancements in the profession and also in technology. I've just been on a 2-day course organised by the Johnson & Johnson Institute. So we've been using the OCT machine behind me and interpreting OCT images, as well as engaging in discussion workshops around various patient scenarios. So it's been a great way to consolidate all that knowledge that you've gained throughout your pre-reg and discussing it and sharing it amongst your peers. So overall, if you're thinking of doing your pre-reg at a multiple practice, then expect to see lots of patients. It's going to be really busy, but you don't have to worry then too much about seeing the required number of patients. But I think one thing that you really do learn throughout your pre-reg at a multiple is time management and managing your own clinic. The courses are also really well structured and organised, and they guide you through each stage of the pre-reg, which makes you feel more confident in the lead up to the assessments. I think what really makes high street practice enjoyable is the fact that you could be seeing just routine checks to patients with various symptoms. So pre-reg at a multiple really does keep you on your toes.